Welcome to Bad to the Bones, the podcast where we discuss everything related to orthopedics, joint health, and living an active lifestyle. Welcome to Bad to the Bones podcast. I'm your host, Debbie Rohde. Today, our special guest is Dr. Eddie Wu. He is with Premier Orthopedic Associates. Dr. Eddie Wu is Board Certified Orthopedic Surgeon. He's fellowship trained in adult total, hip, and knee joint reconstruction. He treats patients with a variety of orthopedic ailments, specializing in the care of patients who have hip and knee disorders. Welcome to the show, Dr. Wu.
Thanks for having me. Glad to be here.
We're excited to have you here. We've got some great topics we'd like to cover, and we've got some great models here, too, that we hope to get to in the show.
Yep.
But to start off, can you tell us a little bit about your background and what inspired you to specialize in joint replacement?
Yeah, so joint replacement is a subspecialty of orthopedics. Growing up, much like many of our listeners, sports was a big part of my life, still is today. And so I was big into basketball, playing in high school, and I had suffered an injury to my knee. I had a torn ACL, and that kind of was a bummer as a 17-year-old, so I had to go through the whole process of surgery and physical therapy. And part of physical therapy was, the regimen was 4 to 5 days a week for 6 months.
Oh, that's a lot.
And so I'm like, wow, that's interesting, So I thought physical therapy would have been fun. So I actually went to school to become a physical therapist. Okay. I finished that. And then, you're never really happy with what you have. So as part of my physical therapy curriculum, they allowed us to go into the operating room to watch a total joint replacement.
Yeah.
And so I remember getting put in the corner, don't touch anything that's blue. And
yeah.
But that kind of planted the seed of orthopedics and ultimately joint replacement. I was really intrigued by the surgery that I saw that day.
Nice. That's awesome.
Yeah.
And so in the field that you're specializing in, let's talk about some of the common medical conditions that you see as when patients come in that would require them to have joint replacement surgery. Like what are they coming in like?
Yeah. So the main indication for joint replacement is arthritis, or commonly known as degenerative joint disease. So I guess the real question is, what causes arthritis and what causes degenerative joint disease? Well, there are a lot of reasons, and that's one of the most common questions we get in the office. Things that cause arthritis are normal wear and tear things. Trauma can cause that. Previous surgery can cause irritations of the joint to cause arthritis.
Yeah.
There are medical conditions that can cause arthritis, things like rheumatoid arthritis or previous infection, or metabolic things like sickle cell disease or avascular necrosis. But the end result is always the joint deteriorating, the cartilage wearing out, and becoming an asymmetric and worn out bearing or joint.
So with osteoarthritis being a major cause of joint deterioration, are there any statistics about who is most likely to be affected in terms of gender and age? And
yeah, great question. So statistically speaking, women are more affected than men.
Interesting.
And I think that there are more women on this planet than men, so that might play a role into it. But I think the statistics lean more in favor of women.
Okay.
Genetics certainly play a role, and that's one of the most common things that we get asked in the office. Well, what caused this? I don't play sports and I don't do this and that, but sometimes genetics play a big part. So then you start asking, well, did mom or grandmom or anyone in your family have a joint replacement? And all of a sudden those answers start coming out. The hip and the knee are the most commonly affected joints with arthritis.
Mm-hmm.
And people say, well, how come other joints don't need to be replaced? Well, the hip and the knee are the most load-bearing joints in the body. So they're the ones that bear all your weight and affect function and become really debilitating. So I think it's 25 million Americans get affected with arthritis. Hip and knee are the most common.
And what age are people typically coming in with this deterioration?
I mean, hopefully older than younger. But I think 50 and above, I would say, is a safe range. Something like 1 in 5 adults 50 and over will require a hip replacement, something like that.
Okay.
Yeah, depending on the source that you read.
So when a patient comes into you for an initial evaluation, what can they expect in terms of, what information you're going to provide and what the evaluation is like?
I think, every physician, every provider interacts with their patient a different way. For me, we introduce ourselves, right? We get a good history. Hey, how long has the pain been going on for? What activities hurt it? Anyone else in your family have arthritis? We go over your x-rays that you got. We'll explain to you what arthritis is and how it looks on the x-ray.
Yeah.
And then go over your treatment options. We'll go over non-operative things. We'll go over operative things and kind of answer any questions that you may have and keep it open-ended.
And when a patient comes into you for their initial evaluation, do you find that they've been putting this off for a long time and it's just like, now I really can't do anything that I want to do?
Yeah,
So
I would say it's 50-50. Some patients don't know that they have arthritis and it's the first time that they're seeking treatment.
Yeah.
Other patients, just like you said, have been having symptoms for years and years and years and finally understand that something needs to be done.
Yeah. And when you get to the evaluation process, how do you know that someone really is a good candidate for a hip or knee replacement? I mean, is there like a certain amount of deterioration that identifies that immediately?
You have to have some level of arthritis in the joint. Obviously, if there's no arthritis on the x-ray or potentially even an MRI, then potentially that pain may be coming from somewhere else. And
Yeah.
so that's why it's important to get a good history, a good physical. Pain from other parts of the body can refer to the hip or the knee.
Okay.
So x-rays, you definitely have to have a significant amount of arthritis to be a candidate for joint replacement. And then again, a good history, a good physical exam, good history of what their other medical conditions are.
Yeah.
Because surgery is a big deal. It's a big risky procedure. There's risk with it.
Yeah.
And so you want to make sure that the patient is a good candidate and as safe and optimized as they can be before they go through surgery.
So what are some of the risks and benefits that you discuss with your patients?
Yeah, so the risks of surgery include, anesthesia risks and blood loss and, stiffness, depending on whether it's the hip or the knee. There's a recovery process associated with it. God forbid, wound healing issues and infection and things like that. The benefits, which usually are far more than the risks, would be getting your life back, pain relief, increasing quality of life, getting you back to the things that you want to do.
Yeah.
So that's an analysis and a discussion that we have with every patient if they're considering joint replacement.
What are some of the risks or that the patient is mostly concerned about?
The patients are mostly concerned about not being able to get back to the things that they want to do.
Oh, okay.
Yeah, and how long they'll be in the hospital for, and pain after surgery, things of that nature that we all discuss in the office.
Yeah. And so can you walk us through what is involved in a typical joint reconstruction, whether it's the hip or knee? I know you have some models here. I don't know if it makes sense to reference.
So we can start with the knee since it's the closest to me. This is a model of a knee replacement. And so I think to better understand what a knee replacement is, it's important or it's helpful to understand what a normal knee looks like. So this is what a normal knee looks like. And so what a joint replacement does is that it starts to take slivers of bone that are worn out and deformed, and you get a cap of metal and plastic. So if you can imagine what that knee looked like, during surgery, the end of one bone is made to look kind of like this.
Oh, okay. Yeah.
And then that gets capped with something that's made of metal. And then same thing on the tibial side, a sliver of bone is removed, and that gets replaced with something that looks like this, that's made of metal, and this is a form of plastic. And then now that's your new joint replacement. So you don't have any of those irritated bones rubbing up against each other. And then on the other surface of the kneecap, if it's really worn, we may or may not decide to take a sliver and replace it. And then same thing on the hip side. If you can imagine this as a normal ball and the socket's over here, the bad ball that's worn out is literally removed, and that gets replaced with a metal stem. That's your new ball, and the socket's also made to accommodate something that looks like this. And again, this is mostly metal.
It's just like a metal cup.
Yeah, metal shell.
Yeah, shell.
Yep.
Yeah.
And that gets impacted in there, and that grows into your bone. And so now this is your new perfectly congruent ball and socket joint. So,
and do you have issues with scar tissue and like, reducing mobility, or is that a complication after?
Yeah, it's interesting. Mostly scar tissue is really not an issue with the hip.
Yeah.
It's more of an issue with the knee, and that's why stiffness is more prevalent in the knee.
Interesting. Okay.
And so you never have someone come in after a hip replacement with a stiff hip.
Yeah.
But you have heard perhaps have heard of people with a stiff knee after knee replacement. So scar tissue forms no matter what,
Yeah.
but it definitely affects the knee more so than the hip.
And when with the knee, can you feel any of those, any of the
Parts?
like when you rub over your skin? Does a
Um,
patient feel those?
You may be, if you really were to push hard, you might be able to feel some edges, but for the most part, the knee is covered in a big capsule that's about a centimeter thick.
Yeah.
So it's not like it's the skin and then just the metal.
Right.
There's a whole bunch of tissue covering the metal.
Very cool.
Yeah.
Very cool. So if you were to explain to our listeners the stages of recovery following a joint replacement, what do you tell your patient to expect after surgery?
So every patient, I kind of give a whole spiel on about what to expect. So there's early stages, there's mid stages, and then there's, I guess, the late stages you can call it. The early stages, they're on a walker for a couple weeks, but we get them up moving a couple hours after surgery.
Yeah.
And that acute stage is probably there for a couple weeks. Things will swell. We'll get your pain under control, but you'll be comfortable enough that you'll be walking on your own with the walker. Then there's a subacute stage where we may or may not send you to physical therapy to get the joint moving a little bit more, start strengthening it.
Yeah.
And then the late stages are really starting to involves the patient getting into the things that they want to do. So whether that be golf or getting back into the gym or exercising more or swimming or biking, those are more of the subacute / late stages where they start to strengthen it and really challenge the joint to get back to the things that they miss doing.
Do you find a significant difference in the healing process from someone who does go to PT versus someone who can't, for whatever reason, go to physical therapy?
Yeah, that's a great question without a great answer.
Yeah, because I'm sure it varies person to person.
It does vary person to person. Believe it or not, there have been studies on people that go to physical therapy versus not going to physical therapy.
Yeah.
There have been studies on patients that do web-based physical therapy versus outpatient therapy.
Yeah.
And it's really mixed. There's not a clear winner.
Yeah.
So as long as the patient's motivated, I think they're going to do great, whether they go to outpatient therapy or they do it at home. As long as they're motivated and that they understand what to do.
So how long is it before they have to follow up with you after their surgery?
Patients are generally brought back in the office at standard intervals. So at 2 weeks or 10 to 14 days, we see them back, make sure the wound is healing well, may take out the stitches or whatever closure methods that the surgeon used. We see them back again at 6 weeks, or at least I do. Again at 12 weeks, again at 3 months, 6 months, a year.
Yeah.
So pretty regularly during the first year.
So do you ever find that when a patient comes back to you, after they've completed their physical therapy, that they have to go back to physical therapy? Is there like follow-up x-rays and MRIs that you do to make sure everything is there?
Yeah, every patient is definitely treated separately, but for the most part, therapy's 4 to 6 weeks of physical therapy. If the patient desires to go more or they're having a little bit more stiffness than someone else, we may decide to send them to a little bit more physical therapy. We check x-rays pretty regularly, at least I do, 6 weeks, 6 months, and a year, just to make sure everything is healing appropriately. And so, like I said, the first year, it's about 5 times that we see you back in the office to make sure that you're on track to get the best outcome.
And is there a few activities or anything in particular, whether it's with the hip or the knee, precautions, that lifestyle changes that you kind of give to your patient to say like, hey, it's probably not a good idea that, you jump on that trampoline.
Right.
Whatever, I don't know.
So although, our joint replacements are able to get our patients back pretty much to everything they want to do, for the most part, we encourage patients to avoid high impact activities, repetitive high impact.
Yeah.
So examples include running repetitively or jumping. If you do that once in a blue moon, it's fine. If you're running from an animal or the cops or something.
A fight,
Right. But if you do it at the gym, if you like running at the gym, it's something that we encourage you to try to avoid, just to make the joint replacement last as long as possible. But for the most part, people get back to things like yoga. You may have to modify some of the positions. Some of those positions are a little bit more provocative that place the joint at extreme positions. But people get back to yoga and golf and pickleball and hiking and swimming and
I was just talking to a friend of mine on the way over whose husband had a hip replacement like 7 years ago.
Hmm.
And I was like, hey, does he have any issues with it? She's like, absolutely not. He does everything. I
Hmm.
mean, he's so active. He doesn't put a lot of joint, pressure on the joint. Like he
Yeah.
doesn't run, but he does like the stair climber at the
Yeah.
gym and he swims a ton of miles.
Body
and-
surfing. I saw an 82-year-old recently that he likes body surfing.
Yeah.
It's regular surfing. I
But he
think it's
has to get that replaced at some point, right?
maybe, maybe not.
Okay.
Depends. Yeah, there are a lot of reasons for needing a redo.
Yeah.
But that's why it's important to get X-rays. Once you hit a year, every few years, come back for a quick X-ray check to make sure things aren't wearing out.
Yeah. Cool. So, if you were to measure the success of one of your patients who had joint replacement or joint reconstruction, how do you measure the success of that surgery?
I think every patient's different.
Yeah.
It's, what I tell patients in the office is if you're happy, then I'm happy. Right?
Yeah.
And so
Yeah.
one patient's activity level that they get back to may not be the same as the others. So
Right.
my 85-year-old patient that just wants to get out of pain and is happy walking around the house, that's their success. Their surgery was a success.
Yeah.
If I have a 50-year-old patient that wants to get back to playing golf without pain, as long as they can do that, that's a success. So as long as the patient is able to get back to the things that they want to do
Yeah.
without pain, I think
That's a success.
That's a success.
That's a good measure. I like
Yeah.
that. I could take that. How about a memorable success story? Like, is there a patient that came in just really down and out and, you really gave them their life
Yeah.
back?
And so the whole goal of joint replacement is to get people out of pain and
Yeah.
improve their quality of life. So one particular example sticks out. It was a middle-aged woman from Haiti and didn't have health insurance in Haiti, and the medical care there may not be what she wanted.
Yeah.
And so she came back to the United States because her son-in-law or her son lived here, and we got X-rays because she couldn't walk, and the X-ray shows just very severe degenerative joint disease with real bad deformation of the joint. I mean, the ball wasn't in a ball anymore. The socket had eroded away.
That's
And so it
just
was-
not fair.
Yeah, it was on both sides, and so she couldn't walk, and the son was having back pain because he had to lift her up every time.
Oh my gosh.
She had to use the restroom, or just really dependent and awful quality of life.
Yeah.
So she needed both hips done, or bilateral hip replacements. And so we did one at a time, and it was a very complicated case. And we used the assistance of, technology and robotics to
Yeah.
help us give her the best chance of a good outcome. And so fast forward the clock about a year and a half, we got both done. And the last time I saw her was probably for her 3-year follow-up, and she walks fine now.
Oh, that's
Yeah, and the son no longer has back pain. And
yeah. The whole
And so-
trickle down effect.
Yeah,
for
it's
the
great.
family now.
It's great. So
That's great.
that really sticks out to me because she was
Yeah.
really unable to walk. And then another thing, another one that really sticks out is, so I've been with Premier now just over 10 years. It's gone by very,
That's gone
very
by
quick.
really fast. Wow.
Yeah,
Okay.
I just saw my first hip replacement that I did here back for her 10-year visit.
Oh, wow.
It was for something separate.
Yeah.
And so she's very happy, and it was actually for something unrelated to the hip.
Yeah.
But we got x-rays, everything looked great. She was really happy with it. But seeing patients that far out
Yeah.
still have benefit from the surgery that we did
Yeah.
a decade ago
Yeah.
is really rewarding.
I was going to say
And
that's
so-
very rewarding.
yeah,
It's a
so
testament to your passion.
That's the longest follow-up that I have.
Yeah.
And so I saw her back probably a few weeks ago. So that was interesting.
Very nice. That's awesome. Well, as we wrap up here, what advice would you give to anyone who's really hesitant about coming in to discover what is going on with their joint pain?
Yeah, I think knowledge is power.
Yeah.
Just because and I've said this from day one, just because you're coming in to see an orthopedic surgeon doesn't mean that you have to get surgery.
Yeah.
There are several options that we can discuss, any and all options. So if you're hesitant, a surgeon should never pressure you into getting surgery.
Yeah.
Our job is to explain to you your options, the risks and the benefits, and then it's your job as the patient's job to make the ultimate decision. So if you're hesitant, don't be. Come in, get some facts. The more knowledge that you have, the more power you have to make an informed decision about what
Yeah.
you want to do. And joint replacement isn't for everyone. You may not even need it.
Yeah.
That pain in your hip or your knee can be coming from somewhere else.
That's
and-
what I was just going to say. You
Yeah.
spoke about that earlier.
but
yeah.
you'll never know unless you look into it. And so I encourage anyone that's hesitant to at least come in to collect information, if anything.
Yeah. Well, Dr. Wu, thank you so much for sharing your insights and your expertise with us today. It's really been incredibly informative. And
Thank you.
I
It's
like the models you brought in
been
here. It
fun.
definitely brings some clarity to what's going on underneath the skin.
Yep.
And to our listeners, thank you for tuning in to another episode of Bad to the Bones. If you found our episode helpful, subscribe to our YouTube channel and Spotify and wherever you subscribe to your podcast, and share it with others. I think it's going to be very helpful. If you're experiencing joint pain, like Dr. Wu said, come in, have a consultation. It doesn't mean you're going to have surgery. Just get the facts and get an understanding of where the pain's coming from. Schedule an appointment with us at 856-690-1616. You can call or text that number. You can also go on our website at poasnj.com and schedule an appointment online. We have offices all across Southern New Jersey, and we hope to see you in one of them. Until we see you in person, have a great day and stay healthy.